Hi, I'm Parsio Vagathy. I'm Chief of Surgical Transplantation at UT Southwestern. Today I'm going to talk to you about what to expect for your kidney transplant. For deceased donor kidney transplantation, these can occur on any day or at any time. Often you'll receive a phone call from one of our coordinators and they'll notify you that you are up for a kidney transplant. This call can come at any day or time, and thus you should always have your phone available and a backup phone number listed with one of our coordinators just in case you're not able to answer your phone. The coordinator will discuss with you the organ offer and also will let you know any pertinent information in terms of when you should arrive at the hospital, when your last food or drink should be, and whether or not you should proceed to dialysis at your own center prior to coming into the hospital. They'll also give you a time to arrive to the hospital where you'll go through the admission process and be brought up to our transplant floor. Once on the floor, you'll have all of the standard preoperative testing, including blood work, a chest x-ray, an EKG, and also you'll meet the team and sign your surgical consent form. Bear in mind that there is some final testing that has to be done between both the donor and the recipient to make sure that the kidney is compatible, and this will be performed while you're waiting to have your kidney transplant. Once the testing is complete and we know that there's full compatibility and we know that the kidney is a good quality kidney as assessed by our team, then we'll proceed to the operating room for the kidney transplant. There is a possibility that you're brought into the hospital for the kidney transplant and the testing is positive, or on biopsy the kidney is not suitable for transplant and then you would be discharged home without the kidney transplant, and we would hope to have you be brought back at a soon date thereafter to get a better quality kidney transplant. If you do proceed to kidney transplant, the operation usually takes about 3 to 4 hours. Your old kidneys are left in place most often unless there's an indication to remove them, such as an infection or a mass or a history of bleeding from the kidneys. But most often we leave your native kidneys in place. The transplanted kidney is placed in the right lower quadrant most often, or sometimes on the left side if there's been previous surgery on the right side. We hook up the new kidney's blood vessels to the blood vessels that run to the leg, and most often we place the urine tube that drains the kidney right into your own bladder so that you'll be able to urinate normally following transplant. Sometimes a small stent is placed to protect that new connection between the ureter and the bladder, and that stent is removed in the office as an outpatient 3 to 4 weeks following the transplant. Immediately after surgery, you'll go to the recovery room, and from there you'll be transported back up to the surgical transplant floor. Most patients stay in the hospital for 3 nights following their kidney transplant. The function of the kidney can vary. Some kidneys are slow to produce urine, whereas others can produce urine right away, and this will be carefully assessed by the inpatient team. An assessment will be made on a daily basis whether or not any further dialysis is needed while the kidney is recovering from the transplant procedure. In the recovery period, you'll be encouraged to begin walking early after surgery the following day, and your diet will be slowly advanced from liquids to solid foods. In addition, you'll meet with various members of the transplant team to start learning all of your new medications as well as your dietary restrictions for an anticipated discharge on the 3rd postoperative day. At the time of discharge, you'll complete the educational process on the day of discharge, and then you'll be given all of the appointments that you'll need in the postoperative period. This will include usually visiting a lab twice a week to obtain lab values, and visiting the clinic at least once a week in order to assess your progress and also assess whether any further dialysis is needed while the kidney regains full function. During this time period, your labs will be closely monitored and any medications will be adjusted based upon your lab values. It is very important that you maintain your lab appointments as well as your doctor appointments in this postoperative period. As the kidney gains further function and you begin to recover further from the surgery, these appointments and lab visits will be spread out further and further. As mentioned, some patients have a stent placed to connect the ureter to the bladder. This will be arranged to be removed as an outpatient approximately 3 to 4 weeks after the surgery, and this will be done in the office by the urology team. It is important that you have a support structure in place following surgery for at least 2 to 4 weeks, as you will be recovering and will need assistance with such daily tasks as grocery shopping, driving to appointments, and driving to lab visits. As mentioned, As you gain back your strength, you will be able to function more independently as time passes. Usually by 1 month after surgery, people are fully independent again as they were prior to surgery. Most patients are discharged directly to home following the kidney transplant. Many of our patients come from far distances. If this is the case, we have an excellent team of social workers that can assist in finding you temporary lodging in the DFW area so that you can maintain your lab visits and clinic visits in the immediate postoperative period until you are safe to return to your home. What are the risks associated with the transplant surgery? As mentioned, not all kidneys function immediately. Therefore, there is a chance of what we call delayed graft function, where you will require dialysis in the postoperative period within the first 7 days, and sometimes this may extend into your recovery while at home. Do not worry, our nephrologists work very well with your outpatient nephrology team and will set up dialysis at your local dialysis center until the kidney is fully recovered. In addition, our nephrologists will work with you to maintain your diabetes, your high blood pressure, and any other medical illnesses under good control in the postoperative period. We have an excellent transplant pharmacy team which will go over all of your medications while you're in the hospital and ensure that you're on all the right medications when you return home. Other risks associated with transplant is the risk of rejection, not having enough immunosuppression, or a risk of developing an infection because you have too much immunosuppression. Again, this will be closely monitored in the postoperative period by our nephrology team and our clinic to make sure we minimize the risk of developing either rejection or infection. There's always a very small chance that the kidney is lost in the postoperative period. This is a very rare event and something that we are very vigilant about making sure does not happen. Our results for our program, as well as every other program in the United States, are published on the Scientific Registry of Transplant Recipients webpage. This can be found by logging into www.srtr.org, where you can look up any transplant center program's results. Here you'll find survival at the 1 month, 1 year, and 3 year time intervals for all of our kidney transplant recipients, as well as the volume of our program and our waitlist size. If you have any questions about how to interpret this data, please feel free to reach out to your coordinator or your nephrologist so that we can help explain it to you. You will also be provided all of this information during your visit at our clinic. Please remember that our team is available 24 hours a day, 7 days a week to assist you with any needs following your transplant. It is imperative that you stay in communication with us if you develop any signs of a complication or any signs of an infection at any time point following your transplant. For non-urgent questions, we can always be contacted through the MyChart secure email communication tool that you'll be linked to following your transplant. Always remember our phone number is 214-645-1919, and we can be reached at any time of the day for any serious concern. In the event of a serious emergency, please remember to call 911 and proceed to the closest emergency room, and from there, please inform them that you're a kidney transplant recipient from UT Southwestern, and they will contact us and we'll work expeditiously to bring you back to UT Southwestern for further evaluation. Thank you for your time, and thank you for choosing UT Southwestern as your provider for kidney transplantation. We look forward to continuing to care for you, not only during the transplant procedure, but for the years to come.